Hello all, I am Dr. Vibhash Vaidya, and today in this video we're going to discuss about the palatine tonsils. There are two palatine tonsils which is commonly called as tonsils. Here you can see in this picture the each tonsils is almond in shape mass of lymphoid tissue which situated in the triangular fossa, or this triangular fossa is known as the tonsillar fossa. And this tonsillar fossa, which is situated on the lateral wall of the oropharynx between the anterior and the posterior pillars of the fecus. Here, this is the anterior pillar which is formed by the palatoglossal arch, and the same manner this posterior pillar which is formed by the palatopharyngeal arch. Now we'll discuss about the boundaries of the tonsillar fossa. So first the anterior boundary. Here this is the anterior boundary, and this anterior boundary of the tonsillar fossa which form the platoglossal arch, and this platoglossal arch contains the platoglossus muscles over here. This is the platoglossus muscles. The same manner, the posterior boundary of the fossa which forms the uh, platopharyngeal arch, and this platopharyngeal arch which containing the platopharyngeus muscles, and the lateral boundary of this tonsillar fossa which formed by the superior constrictor muscles mainly, and along with this superior constrictor muscle the lateral boundary also forms by the tonsillar bed. Then the apex of the tonsillar fossa is formed by a soft palate. Here this is the soft palate where the anterior and the posterior pillars or arch meet, and the base over here we can appreciate the base of the tonsillar fossa, and this base is formed by the dorsal surface of the posterior one third of the tongue. This is the dorsal surface of the posterior one third of the tongue. Now the tonsillar bed. So as we discussed earlier, the tonsillar bed which forms the lateral boundary of the sinus, and from the inside to outside this tonsillar bed is formed by the pharyngovascular fascia. This green structure is the pharyngovascular fascia. After the fascia, it forms by the superior constrictor muscles, then the buccopharyngeal fascia. So this three structure forms the tonsillar bed. Then the external feature of the tonsil. So the tonsils has the medial surface, lateral surface, anterior and the posterior pole. So first we'll see about the medial surface. So here we can see this is the medial surface of the tonsils, and this medial surface which lined by the non-keratinized stratified squamous epithelium which dips into the substance of the tonsils which forming the tonsillar crypts. So here we can see this epithelium which dips into these tonsils and form a deep crypts, and these crypts is known as the tonsillar crypts. One of the crypts situated near the upper part of the tonsil, and this crypt is very large and deep, and this large and deep crypt is called as crypta magna or intratonsillar cleft. So here this is the intratonsillar cleft. The crypts may be filled with the cheesy material consisting of the epithelial cells, bacteria, and food debris. Now, the lateral surface. So here we can see this is the lateral surface of the tonsils, and this lateral surface which is covered by a well defined fibrous tissue known as the tonsillar hemicapsule. So this green structure is known as the tonsillar hemicapsule. And in between these capsules and the tonsillar bed, we can appreciate over here a loose areolar tissue, and this loose areolar tissue is known as the peritonsillar space. This peritonsillar space and the loose areolar tissue makes it easy to dissect the tonsils in this plane during the tonsillectomy. And this peritonsillar space which site of collection of the pus in the peritonsillar abscess. Now the superior constrictor separate this surface from the following structure. So here in this picture we can appreciate the superior constrictor which separate this tonsillar from the facial artery. This one is known as the facial artery, and its two branches. One is ascending palatine and another is the tonsillar branch. Then it also separates the styloglossus muscles. So here we can see this is the styloglossal muscles and the glossopharyngeal nerve, and the styloid process when it elongated, and the angle of the mandible and the medial pterygoid muscles. Now the superior constrictor separate this surface from the following structure. So in this picture we can see this is the superior constrictor muscles, and this superior constrictor muscle separate uh, the tonsils from this following structure. Like first we can see the facial artery and its two branches. One is the ascending palatine and another is the tonsillar branch. Then the styloglossus muscle, this one is known as the styloglossus muscle. The glossopharyngeal nerve, this yellow structure is known as the glossopharyngeal nerve. The styloid process, if it is elongated, then the angle of the mandible and the medial pterygoid muscles and this submandibular salivary gland. So these are the structure which separate by the superior constrictor muscles. Then the anterior border, this is the anterior border, and the anterior border which passes underneath the platoglossal arch. Here we can appreciate this is the platoglossal arch. In the same manner, this is the posterior border, and this posterior border which passes underneath the platopharyngeal arch. This is the platopharyngeal arch. Then the upper pole, here in this picture we can appreciate this is the upper pole of the tonsil. It extends up into the soft palate. This is the soft palate, and its medial surface is covered by a seminular fold extending between the anterior and the posterior pillars, enclosing a potential space, and this potential space is known as the supratonsillar fossa. In the same manner, this is the lower pole, and this lower pole of the tonsil which is attached to the tongue by a band of the fibrous tissue, and this band of the fibrous tissue is called as the suspensory ligament of the tonsil. So these are the external features of the tonsils. Now we'll discuss about the arterial supply of the tonsil. So first, it is supplied by the tonsillar branch of the facial artery. Here we can see this is the facial artery, and from the facial artery one of the branches arise, and this branch is known as the tonsillar artery. And this tonsillar artery is a principal artery and enter the lower pole of the tonsil by piercing the superior constrictor muscle. Then it also supplied by the dorsalis lingual branch of the lingual artery. This is the lingual artery, and from the lingual artery here two branches is rise known as the dorsalis lingual artery, which is also supplied toward the lower pole of the tonsil. Then it's supplied by the ascending palatine artery, then the ascending pharyngeal artery, and the greater palatine artery. And this greater palatine artery is also known as the descending palatine artery, which is a branch of the maxillary artery. This is the maxillary artery. So these are the arterial supply of the tonsil. Now we'll discuss about the venous drainage of the tonsil. So the veins from the tonsils drain into the paratonsillar vein. So this is the paratonsillar vein. And this paratonsillar vein descending from the soft palate, here this is the soft palate, and from the soft palate this paratonsillar vein descending downward crosses the lateral aspect of the tonsillar capsule, and finally it pierces the superior constrictor muscle and drain into the pharyngeal venous plexus. So this is about the venous drainage of the tonsil. Now we'll discuss about the lymphatic drainage of the tonsil. So the lymphatics of the tonsils pierces the superior constrictor and drain into the upper deep cervical lymph node. And this upper deep cervical lymph node particularly named as the jugulodigastric lymph node. So this is the jugulodigastric lymph node. It is often called the tonsillar lymph node because it is primarily enlarged in the infection of the tonsil, is known as the tonsillitis. The tonsillar lymph node is located below the angle of the mandible. Here this is the angle of the mandible, and below the angle of the mandible we can appreciate this is the jugulodigastric or tonsillar lymph node. Now we'll discuss about the histological structure of the palatine tonsil. So first, this is a picture which shows the medial surface or crypts of the tonsil, and this medial surface and the crypts of the tonsil, palatine tonsils, are lined by the stratified squamous non-keratinized epithelium. Here on the another side, this is a magnified picture, schematic picture, which shows the stratified squamous non-keratinized epithelium, which lined over this medial surface and the crypts of the tonsil. Then underneath the crypts there are numerous lymphoid follicles. Over here we can appreciate here it present a numerous lymphoid follicles. Then the lateral surface of the palatine tonsil is separate from the underlying tissue by a hemicapsules. So this is all about the histological features. Now we'll discuss about the clinical anatomy of the tonsils. So first clinical anatomy is tonsillitis. The tonsillitis is frequently site of the acute infection, especially in the school going children, and it also affect the adult also, and it mostly seen in the viral infection, and it is rare in infant and the person above 50 year of age. Then second clinical condition is follicular tonsillitis. In this condition, the infection spreads into the crypts, and this infection becomes filled with the purulent material presenting at the openings of the crypts as a yellowish spots. So this is all about the palatine tonsils. I hope all of you understood the topic. Thank you for watching.